I'm Paul Lorenc. I'm a plastic surgeon in practice right here in New York City.
I'm Mark Nestor. I'm a dermatologist in the Miami, Florida area.
Hi, Jeff Kenkel, a plastic surgeon from Dallas.
Paul, how does the consumer benefit with the entrance of a new neuromodulator in the United States?
Well, by the third player being in the game right now, Xeomin, I think it benefits not only the consumer, but I think it also benefits us as aesthetic physicians. And what I mean by that is that we will have another choice in treating our patients. I think the patients will be, their issues or specific concerns can be addressed even in a more specific way. So overall, I think it's a benefit.
I think one of the other big things that happens when a new toxin comes on the market is the press picks it up. And I think that any time the media, whether the written or television media, picks up on something new, it expands the awareness and it gives education to our patients just in general on what we do as aesthetic physicians, and certainly from the specific aspects of toxins.
So you think that helps grow the market, more interested people?
It helps educate patients, and it absolutely helps grow the market in everything. Patients begin to understand that they can help themselves in terms of how they feel, how they look about themselves, and certainly once they start coming in and asking questions, we can treat them.
Dr. Kenkel.
And even though the products or the toxins that we're using now are more alike than different, there clearly are some differences. And when we brought the second toxin in, there was clearly some patients that either responded better or felt like they got a better result with one product over another. So now that we have a third product coming in, who knows, as we get more experience, there may be different roles for different patients with this new toxin. So I think it's great to have more choices as a patient and physician is always a good thing.
Does the consumer benefit from the entrance of a new neurotoxin available in the United States?
Well, I think having three choices now, it's a very good thing. And I think it ultimately, again, as Dr. Kenkel said, it benefits the patient. You decide mostly based on each patient's needs and on anatomical areas or muscle mass. So there are a lot of different evaluations or examinations of the patients that we do pre-injection. And having three different neurotoxins right now will allow us to be very specific in addressing each concern.
I think one of the things that we've noticed when you have pharmaceutical companies competing for a non-healthcare reimbursed dollar is that they can be very aggressive when it comes to marketing and when it comes to giving patients things such as rebates. And I think in our practice, patient rebates have been incredibly effective at both bringing patients in to the practice saying, you know, I learned about this rebate, I can get directly from the company, and helping us lower the cost of the procedure to the patient from directly receiving money from the pharmaceutical company. So I think what we probably will see is a stepped up marketing and pharmaceutical campaign from all of the three companies marketing the toxin, and I think that will benefit consumers price-wise, not because necessarily we'll drop our prices, but they'll get some money back in the form of rebates.
The companies that provide these products for us also have other products in their armamentarium. How does that play into the equation?
Well, I think from a marketing standpoint, I think a lot of these companies will market their products together. Perhaps they may even sell them to physicians as packages, which again may benefit both the physician and the patient. And I think it's just like we were talking about with the toxins, it's just increasing awareness, which we hope will not only benefit the patient, but give them more options to treat specific things that they're looking to improve on.
Now, it seems like in certainly a downturn in the economy like we're having here, patients are more interested in the minimally invasive type treatments. How does that affect your practice, Dr. Lorenc?
Well, I have to tell you that seeing the downturn in the economy in October of '08, non-invasive or minimally invasive procedures such as neuromodulator injection really maintain a practice such as mine. And I think everybody felt the effect of the economy. We're almost back to where we were at this point in November of 2011, but what it did, it maintained the practice, it maintained patient traffic. so to speak, in the practice and patient interest. So I think a non-invasive procedure such as a neuromodulator injection is fantastic, whether it's a dermatological practice or a plastic surgery practice such as mine.
Dr. Nestor?
Yeah, I absolutely agree. But more than that, what I think we found is that using neuromodulators especially have the ability for patients to feel a little bit better about themselves within this economy, to feel more confident, to be able to go get work, to be able to feel that they can compete better, maybe even with individuals of younger age. So I think that there may be a role for this, for especially neuromodulators in a down economy, in patients who really can, for a minimum amount, change the way that they look and feel about themselves and give them an added boost in bad economic times.
Dr. Kenkel?
Yeah, there's no question. I think we're seeing not only the effect of the economy on surgical procedures, but as Mark had suggested, more people have to stay within the workforce or even go back. And this may allow them, especially if people that are in the sales force, to remain competitive in that area. And then I think we have a whole other generation, the Generation X, that kind of not grew up with a lot of these products, but are certainly very familiar with them, and they recognize the importance in helping them maintain some of their youthful appearance. So a lot of these patients are actually budgeting them into their yearly budget, and it's become something that they are using as often as they need to for maintenance.
How would a fourth neuromodulator do in the market, say in the next year or two?
I grew up on Long Island, and we had a street crossing called the Four Corners. And on the Four Corners, there were 3 gas stations. There was an empty lot on one corner. Guess what happened to that 4th corner? There was a gas station that went up. And the point of that is that there is room in this economy, not only in this economy, but in the future, even for a 4th neuromodulator to come to market. And as I mentioned before, I think it's a very good product. They're safe products, properly administered, they're wonderful products, and there's definitely room for another one.